Okay, JD here. And today we're going to be talking about growth hormones, secretagogues, peptides, and how one particular MLB player, among many others, used them to prolong his playing career. Okay, so let's start. So, growth hormone, GH, what is it? Hormones secreted by the pituitary gland in both women and men, stimulates cellular growth and regeneration. And it's really essential to healthy metabolism, kind of the optimal ratio of lean muscle to body fat, bone density, psychological well-being, right? Heart health, even skin elasticity and thickness, right? So as you get older, without adequate levels, things start to kind of go down, right? South, literally and figuratively, right? Energy levels go down, skin, along with other things, starts to droop, right? Muscle kind of wastes away and says goodbye. And belly fat increases as well. Energy, stamina, vitality overall, right? Dissipate. So without intervention, therapeutic intervention, low levels of growth hormone are unavoidable fact of life as you age, right? So GH levels decrease about 50% or so every 7 years after the age of 25 or so, right? And GH levels can be brought up through to youthful levels, right? 25 years young internally through a few facets. There's injections of recombinant HGH, like human growth hormone therapy, HH therapy. But injections are problematic in a few ways. One, like pricing, they're absurd in terms of the price is almost 1,000 plus a month. Dosing is there's a few risks, like because dosing is the best guess of a doctor, and doses that are too high can lead to reduced efficacy in long run, and also a few metabolic disorders and side effects. And there's also kind of a risk of feedback mechanisms, right? So normally the body controls GH levels. If it's too high, the body stops producing it as kind of a safeguard, right? Because there's a feedback mechanism. Your body likes to go to homeostasis, right? Always likes to go to that. But all that kind of goes out the window when you're kind of overdosing on HGH injections. That's why there's some pretty bad side effects associated with it, like bubble gut, acromegaly, paludism. You can Google these, right? But most importantly, there's a legal risk associated with that. So federal regulations restrict HGH prescriptions and therapy for patients with a few kind of minor, I think, conditions, right? AIDS, short bowel syndrome, or actual GH deficiency. And so really qualifying for those is highly restrictive, right? An off-label prescription of HGH is, it's a banned, it's a felony, right? In many states and highly restricted, right? So you don't need actual HGH therapy for rejuvenation. And so there are all safer alternatives called growth hormone releasing hormones and growth hormone releasing secretagogues, GHRS, right? Also known as peptides, and more on that later. So what they do is they promote the body into making its own growth hormone, essentially restoring GH to youthful levels, right? The effects of secretagogues are significant, right? So we can kind of recomp belly fat down, or skin on the face wrinkles kind of become tighter, less noticeable. You can notice hair growth, energy, and vitality, right? Back to where you were in your 20s, right? And growth hormone releasing hormones and growth hormone releasing secretagogues have a few advantages over HGH therapy, right? When you use these peptide or secretagogues, the GH elevating effects are regulated by negative feedback mechanisms, right? So in other words, if the body senses that GH levels are too high, production stops, right? So that makes overdosing GH extremely difficult, if not impossible. So in other words, there are no side effects with this route. Off-label use also, in terms of functional medicine, anti-aging, isn't prohibited by federal law, unlike HGH therapy, right? And I guess the question is, okay, so how long does this start to work, right? You would feel more energized in a little over a week using injectable growth hormone secretagogues, like other effects like fat loss, muscle mass, longer hair, thicker, more elastic skin will take longer. And it's like, how do they work, right? I think that's the next question, right? So the peptides, work a few ways, right? So growth hormone releasing hormone does exactly what it is, right? It's like the tells the pituitary to secrete GH, and does this by increasing the number of GH releasing cells, also called somatotropes, and the amount of GH released by these somatotropes. And so the most commonly prescribed growth hormone releasing hormones are sermorelin, TGC, and testosterone. And they really have two main effects, right? GHRS, right? The peptides, they promote the release of additional growth hormone releasing hormone, which in turns on more production of more growth hormone. GHRSs, right? Secretagogues, they oppose and inhibit a chemical called somatostatin, which ordinarily tells the pituitary gland not to release any growth hormone, right? There are three commonly prescribed GHRSs, growth hormone secretagogues, right? GHRP6, GHRP2, and ipamorelin. And, you know, the decision next is, okay, so how do you decide what peptide to use, right? And so, or secretagogue to use. Just using a growth hormone releasing hormone like Sermorone, testosterone, or CDC-1295 wouldn't do much. The body's release and supply of some statin kind of inhibit the release of growth hormone. So the key is to use both a growth hormone releasing hormone and a growth hormone releasing secretagogue mixed together in the same syringe, right? So why? The growth hormone releasing hormone release would kind of elicit and stimulate a surge of growth hormone, and the growth hormone releasing secretagogue would promote a further increase, a further surge of growth hormone. And that would also stop the effects of somatostatin, right? Thus allowing for a larger and sustained pulse of growth hormone. So you wouldn't, you know, administer a growth hormone secretagogue by itself, but you would have, you know, a combination of growth hormone releasing hormone and growth hormone releasing secretagogue to have the synergy between the two peptides. At SummaUp, the protocol by Dr. Ryan, as he recommends a blend of the following growth hormone releasing hormones and secretagogues, right? So Sermorone, testosterone, and CGC-1295, they all three of those are growth hormone releasing hormones, combined with eperon, which is a growth hormone releasing secretagogue, or also known as a peptide. So, you know, while the effects of these could be substantial, they do take weeks and months to manifest themselves, right? So just to recap, a week, you feel more energized. Other effects like weight loss, kind of getting leaner, more muscle mass, thicker, kind of skin elasticity will take longer. And then we talked about peptides. So what the heck are these things? So peptides are just phenomenal molecules, right? Simplest way to put it is that they're molecules that just work with the body to create a specific outcome. Okay, to dial in a specific outcome. And a peptide, really simply put, is like a short amino acid chain that functions as signaling agents to achieve a particular outcome while limiting kind of downside, any negative side effects. Peptides kind of, you do a slew of functional benefits, and they improve and optimize and enhance your health in a few ways, and can be life extending as well. Some of the peptides that we could recommend: weight loss peptides, CGC-1295, eperon, AOD 9604, which kind of targets abdominal core fat. There are also reducing inflammation and recovery peptides like BPC 157, which reduces gut inflammation and musculoskeletal and inflammation as well, and is neuroprotective. And thymosin beta 4, which promotes fast healing and reduces inflammation. Funny story here. I'm a huge fan of the snowboarding and electronic skateboards. I had a major accident. I was obviously wearing a helmet, major accident, kind of fell and just, you know, banged up my knee and my hip, and just like had like all this like scarring on my hand. And I went a month with therapeutic, that's an anabolic, plus BPC 157 and thymosin beta 4 for 30 days. And the healing and the pace of how fast I healed was amazing, right? So it was just phenomenal from a recovery standpoint. And, you know, more into that, there are other, you know, neurologic kind of nootropic type cognitive function peptides. I think one that comes to mind is C-Link, which is Russian research indicates that it improves memory learning. C-Max, another one, increases attention span and reduces brain inflammation. So it helps out with anxiety and protects the brain from, you know, chronic stress, because stress leads to inflammation. Okay, so resiliency. Both combine pretty well with something called hydrogen and modafinil, right? But just zooming out a little bit, do these peptides, do growth hormone releasing secretagogues, do they work? Okay. Judging from the fact that major professional leagues have listed them as banned substances that supposedly create a unfair advantage, yes. And they weren't banned because they're unsafe given the numerous clinical studies, right? So, for example, you know, with regard to C1295, even Merlin, okay, there are numerous studies that show that it actually is a alternative to growth hormone, right? And it's safe, right? So here's one study talking about individuals between 21 and 61 years young, no serious adverse reactions were reported, right? Super interesting. Okay. And there's a whole slew of these things. And, you know, you always want to back up research with actual case studies. And so in particular, one legendary MLB player used them to enhance the longevity of his playing career. Full stop. Contrary to popular myth, A-Rod is actually a genuine dude. In retrospect, I actually met him at an Equinox in New York City of all places, down to earth, approachable. You know, and playing decades of 162 long seasons is not easy. And his commitment to the game and knowledge were just remarkable. One thing I have to say, his TikTok game on multifamily real estate be a lot better. And that's just one critique. But what's interesting is, there was a article talking about his proposed regime he used, right, regimen, right? And so he actually did use CGT-1295 and a mix of the growth hormone releasing hormone, right? And it's, interesting because you get to see kind of the doses and so forth, right? And really, it wasn't used to, gain a particular edge in general, but really, like, when we play 162 games, recovery is really important. It's like a long season. So that's kind of interesting to kind of see that, this is hypothetical, right? But it's interesting to kind of see that this was being, UCHC 1295 was being used, right? As one of the adjunctives, right? So that said, if curious about peptides, secretagogues, or growth hormone releasing hormones, right? Ask away. We're here to help, JD, and that's all for today.